Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 133, Cutting Back to Cover Healthcare Expenses. In the last episode, I discussed that Americans' top economic concern is paying for healthcare. A survey released in the last few days by the Kaiser Family Foundation, or KFF, found that 1/3 of Americans report cutting back to cover healthcare expenses. This means that more than 82 million Americans are skipping meals, driving less, skipping medical care, and prolonging medications. Some major life decisions are also being delayed. People have delayed retirement and put off having or adopting a child. Many news outlets have reported the survey. It took them long enough to notice. Back in March 2019, I published 2 podcast episodes on the economics of healthcare. Economist Gerald Friedman discussed most of the same problems and also said that people were going out to eat less often, buying smaller houses, were taking cheaper vacations, or not taking vacations. I have placed links to those previous episodes in the description for this episode. I have also placed links to 2 articles about cutting back and the KFF survey. Note that the articles have essentially the same information, so reading either one will give more details about the numbers involved. We have a choice. We can continue our current healthcare system and watch as people continue paying more for less healthcare and are forced to continue cutting back. The other choice is to implement Medicare for All, which will eliminate the cutting back, cover everybody, eliminate deductibles, co-payments, and co-insurance, eliminate care denials, eliminate restricted networks, and allow people to choose any doctor or hospital. Medicare for All will also eliminate financial hardships caused by our current healthcare system, provide better coverage, and reduce our nation's healthcare costs by anywhere from $430 billion to $1 trillion every year. It's time we made the smart choice and the better choice. It's time to choose Medicare for All. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.